It is my honor to introduce to you the recipient of the Pinedo Prize. Bob Pinedo, for whom the prize has been named, and you see Bob here on your left at the conferral of the knighthood of the Queen of the Netherlands, and having a book written about him with a very simple title. As it is said in Holland, his name is pronounced Bob. So there is Bob, and you'll see the symbol of cancer beneath it. This is his life and work, and at that time, the Pinedo Prize was created. On the right, you'll see the actual statue, which is a direct replica in bronze and brass of Professor Pinedo's hand, holding a globe that could be the world, it could be the hope of a cancer patient, it could be the aspirations of everyone in this room. The Pinedo Prize distinguishes itself and is different from all other cancer awards presented annually around the world. I believe it is, in that it not only distinguishes and acknowledges an expert in clinical oncology who has distinguished him or herself in that area, but it also is a major component of it is the compassionate care of cancer patients and their families, and the instruction and inspiration of generations of fellows attending to cancer patients in the same compassionate way. So whilst it acknowledges excellence in research and teaching, there's a major component that says the recipient of the Pinedo Prize will always have distinguished himself or herself by their real care of the person and of the person's family. I'll read now the past awardees, and you'll see the distinguished company in which we're now keeping. Bruce Chabner was the first recipient at Mass General. Joe Bertino, the Cancer Institute of New Jersey. Bob Lowenberg, the great hematologist and now the editor of Blood at the Erasmus in Rotterdam. Rick O'Reilly from Memorial Sloan Kettering, a marvelous pediatric oncologist. Jose Baselga then followed at Mass General, but soon to be Memorial Sloan Kettering. And last year's Pinedo Prize recipient was Gabe Hortobagi from MD Anderson. And this year, we are delighted and honored to welcome a dear friend, and that's Rich Shilsky and his lovely wife, Cynthia. Dr. Shilsky is known to everyone here for not only being an outstanding GI oncologist, having done his fellowship with Dr. Chabner, in fact, at the NCI, but also as an individual who has a distinguished career himself, but has fostered the careers, in fact, of many of you in this room. Having been for 15 years the chairman of the CALGB, he has stories to tell about us that only he knows. Think of it. There was a statute that said that you could only be chairman a maximum of 10 years. Well, that's a long time. Who would want to serve more? Well, the board of this banana republic gathered together and changed the Constitution so that he could remain on for an additional 5 years. That's called purgatory on earth. He's guaranteed a high place in heaven. During that period of 15 years, if you were to go back and reflect on what it was pre-Shilsky and after, you will see the quantum advances that were not just made in the number of clinical trials, although they were legendary in that, but in the quality of those trials, the innovation of those trials, and the fostering, not just of careers, although that happened to happen, but really the advancement in patient care, as only these independent cooperative groups can do. He was the best of the best. In addition to that, Rich has had also enough time to do a few other things, like be the president of ASCO, an officer of the Conquer Cancer Foundation of ASCO, and as a member of that, I can tell you that no one has contributed more finely than he. There's one last, and it cannot be a last, there's always a penultimate, but a penultimate characteristic of Dr. Shilsky that those of you who know him will recognize immediately. Those of you who don't, take a note of this, that if he says he'll do anything, and more often than not when asked if it has to do with patients, the answer will be yes. If he says he will do anything, it's in the bank before you get home. I've never seen anybody like it. His word is his bond, and when it comes to patients, they are uppermost. It is, for Dr. Muss and myself, a great honor to ask you, Rich, to come up and receive, on behalf of the Society for Translational Oncology, a reflection of Bob Pinedo, for whom this prize was named. You stand in the middle. And this is his hand. There is a story of how I brought this from Amsterdam 2 days ago. The story will be told only privately because it has to do with the TSA agent who saw this go through the X-ray. It is and it's heavy.
Yeah, it is heavy.
And High has also a reflection of the esteem we hold for you, Rich. And
see, I'm the treasurer, so it's a privilege for me to give you the other portion of the prize, which you may pass to Cynthia.
Yes, yes.
So she can redo the kitchen.
It's already been spent.
We know this is already gone. So
thank you so much.
It's a privilege.